Hi again, everyone. I already talked about what men who have sex with men in the Asia-Pacific region want for PrEP. And in this session, I will talk about what transgender women in 11 countries in Asia want for pre-exposure prophylaxis or PrEP. I will go through everything over again for people who just came into the room, and for those who missed some part in the first presentation, you can catch up in this presentation. My name is Warittha Tieosapjaroen. I think everyone can remember my name now. It's like everyone talk about me. So I want to acknowledge all the team on the list here. They put tremendous effort into making this DCE survey study happen. Why do we focus on transgender women in the Asia regions? In 2021, 15.6% of people living with HIV live in the Asia-Pacific regions. As I mentioned earlier, that was the second greatest number of people living with HIV in the world. And there has been increased evidence that trans individuals are disproportionately burdened by HIV, so they become priority populations if we want to end HIV transmission. And another concerning issue is there were about 260,000 new HIV infections in the one region, which is Asia Pacific, in 2021. But UNAIDS tried to achieve fast-track targets by reducing the new HIV infections to fewer than 200,000 new HIV infection cases per year globally by 2030. So we really need to come up with a better approach to reduce HIV transmission in each region and each population. And one of the main effective HIV prevention methods is pre-exposure prophylaxis or PrEP. And to increase PrEP uptake among priority population, we need to understand their needs for PrEP service programs. To do so, we use Discrete choice experiment or DCE, which is an estimate method for quantifying the strengths of preferences. It simulates a real-world situation where respondents are asked to choose between different services that provide the highest satisfaction or utility. Here's an example, as everyone already saw this slide. So when people want to buy a new phone, they compare specification, prices, and system, and then they pick the phone that provides them the highest satisfaction or utility. So we use the same principle and apply it into our study. We used a DCE to evaluate which attributes are the most important driver of choice to use PrEP and explore the impact of different PrEP service configuration on the uptake of PrEP among transgender women living in 11 countries in the Asia. The result of this study can inform the design of acceptable and desirable services and demonstrate PrEP demand in the local context. So we launched our survey in May to November last year through gay dating apps, social media platforms, social media influencers, and local transgender women communities mailing list. Here's the list of the countries that we launched our survey. All of them are low middle income Asian countries. Our survey composed of demographics, questions about PrEP awareness and use, social and sexual practices, and 6 DCE questions. So each respondent was asked to choose PrEP program that they prefer more. They can choose PrEP program A or PrEP program B. Oh, sorry. So if they choose PrEP program A, they will have to pay $25 for oral long-acting PrEP. But if they choose PrEP program B, they don't have to pay for PrEP, but the PrEP that they will get is the injectable PrEP. But then again, they have to consider the whole package and select one that they prefer more, or they can choose to opt out of the survey. Here are the final attributes and levels. Again, I will ask everyone to pick which attribute is the most important driver of PrEP among transgender women. It could be type of PrEP, service location, cost, side effects, extra services. I think this time everyone will get it right because you already got a hint. Inclusion criteria, we included transgender women who were at least 18 years old, had no prior HIV diagnosis, lived in the included countries, and self-identify as a transgender woman. We use RPL model to estimate the relative importance of attributes and predict PrEP uptake comparing the worst, best, and status quo PrEP program. The worst PrEP program included attributes level, least wanted by transgender women, best program composed of attributes level most wanted by transgender women, and status quo composed of attribute levels currently offered. And we use RPL model with interactions to explore the heterogeneity of PrEP or preferences of those who would most benefit from PrEP. Result, in total, we included 1,522 into DCE analysis, and the mean age of the participant was 28 years old. About half of the participants have ever taken PrEP, but less than 10% of the participants were currently taking PrEP at the time of completing the survey. Here is the DCE result. I'm sure everyone get it right. Cost, again, was the most important driver of choice of PrEP among transgender women in the Asia-Pacific regions, followed by type of PrEP and location, service location. And here, in this slide, I want to show you the uptake of the worst and best PrEP service package for transgender women. The worst PrEP service program for transgender women included very high cost implant PrEP with rations of kidney problem as a side effect, while accessing PrEP through a hospital every 2 months and having no extra service. And the worst PrEP program resulted in 50% uptake of PrEP, and this could improve to up to 87% uptake with the best PrEP service program. And the best PrEP service program included free injectable PrEP with no side effects, and while accessing PrEP through peer-led community clinic every 6 or 12 months, and having an STI testing as an extra service. Last thing I want to highlight is transgender women at high risk of HIV infection were more willing to use PrEP if PrEP was provided if they can access PrEP through telehealth, while transgender women at low risk of HIV infection were more willing to use PrEP if they have hormone prescribed as an extra service. Key takeaway, cost was the most important driver of PrEP use, and transgender women who were more vulnerable to HIV were more likely to use PrEP if they can access PrEP through telehealth, and the uptake of PrEP among transgender women could increase up to 87% with free injectable PrEP with no side effect, and accessing PrEP through peer-led community clinics every 6 to 12 months, and having an STI as an extra service. Thank you.